Today we're reporting no new cases of COVID-19. This means New Zealand's confirmed and probable COVID-19 total cases remains at 1,497, and of these 1,147 are confirmed. We now have 1,398 people who are reported as having recovered from COVID-19. This is an increase of 12 on yesterday, and 93% of our cases are now considered recovered. Today there are just 2 people receiving hospital level care in Middlemore and North Shore hospitals, and neither is in ICU. There are also no additional deaths to report today, and we still have the 16 significant clusters, 4 of which are now closed, and a number of which have not had any cases between 14 and 28 days, so they are on their way to being closed off as well. Yesterday our laboratories processed 2,893 tests, bringing the total number of tests completed to date to 197,084. And I actually was on a Zoom call earlier on today with one of our primary health organisations and a number of GPs down in the southern DHB area to thank them for the work they have been doing. That particular area, they've taken over 10,000 swabs, and the effort that goes into for each clinical person to dress up in PPE, to do the swab, to ensure the paperwork is done properly, to get it to the lab, and then the lab staff as well. So every one of those nearly 200,000 swabs, which have been a pillar of our efforts and to support us going into Alert Level 2, has been work on by a number of people, and I just want to again acknowledge that work. In terms of hospital visits under Alert Level 2, an update on that, and obviously our highest priority as we go into Alert Level 2 is to continue to protect visitors, patients and staff, while of course enabling those very important human interactions that are so essential, especially when someone is unwell. On the ground, visits are managed by district health boards, and there will be flexibility on the part of individual clinicians and or managers of services, but the general principle will be in our high-risk areas, which include ED, intensive care and maternity, it will be 1 visitor still and 1 visit per day, while in other parts of the hospital, still 1 visitor at a time, but more than 1 person is able to visit during the day. As I say, there will be flexibility on the part of hospital staff in response to individual circumstances as well. I do encourage people to just check also with the hospital around visiting hours, because obviously those visits will need to occur during the usual visiting hours, and be mindful when you go of those core public health principles of distancing by 2 metres, hand hygiene, and of course do not visit if you are unwell. In terms of the Section 70 order, I've just issued an updated, I'm issuing an updated and amended order, which will be available later today on the Ministry of Health's website. And this order specifically allows people to enter businesses to prepare for the move to Alert Level 2 on Thursday. And finally, today is International Day of the Nurse, and in 2020, it is part of an International Year of the Nurse and an International Year of the Midwife as well. So we are celebrating our nurses now more than ever. It's very clear that having a good, strong, well-trained nursing workforce improves health outcomes for individuals, our whānau and communities. And every day, nurses have played a critical role as part of our COVID response over the last few months, in addition to the work they do routinely providing fantastic care for New Zealanders. And I'm sure all of New Zealand will join me in thanking our nurses today, and indeed every day. Kia kaha, kia maia, kia mana wanui. Thank you, Prime Minister.
Kia ora, Ashley. Can I just reiterate the comments made by Dr. Bloomfield about our nurses? And I have to say, even before COVID-19, I received quite a few letters where people who have been through our public health system really want to acknowledge the workforce within our system, and I often will get a message saying how kind, how professional, how supportive our nursing workforce and our clinical workforce are within our public health system. I don't often get a chance to pass on that feedback, but today seems like the day to do it. Can I also acknowledge that we have a huge nursing workforce trained in New Zealand, working abroad, and who are doing the hard yards through this pandemic as well. And we want to acknowledge all of the Jennies all around the world. Earlier today, the government announced the biggest ever increase in funding for district health boards, as well as additional funding to support DHBs to deliver more services, more surgeries, more procedures, radiology scans and specialist appointments to help clear the COVID-19 backlog. We're investing over $4 billion more into our health system because the lesson from COVID is that we need to be prepared and that a strong health response is the best way to protect jobs and, of course, ultimately be in a position to get our economy moving again as well. We never know when the next virus or health emergency is going to come, but when it arrives, we know that it pays to have a world-class health system in place to deal with it. In fact, that is a commitment we should be making all the time to New Zealanders. When we were elected, we did inherit a health system that did have a number of long-term challenges, not the least of which was some years of underfunding, and public health had experienced that acutely, but also issues with infrastructure and facilities. Over our two previous budgets, we've made a number of investments in health and health capital, and as part of rebuilding together our budget, steps that investment up even further. Alongside our announcement of increased funding for Whāmek on Sunday, it is clear that our Rebuilding Together budget will also ensure that our health system is resourced to get us through and offer even more care and support to New Zealanders. The strength of our health response means also that we're able to get to level 2 and move our economy into a phase where it's opening up again even quicker. Central to this is helping our small businesses get up and on their feet and supporting them as they look to operate from Thursday for many. To assist with their recovery, the first tax refunds in our $3 billion tax package have been paid, with cash flowing into the hands of businesses. To date, 676 businesses have applied for refunds and payments worth more than $62 million. This package, announced last month, is the largest support package to business via the tax system in modern history. Today, I can also confirm that the Small Business Cash Flow Loan Scheme is officially open. In just a couple of weeks, IRD officials built a new system to process applications for loans that will be interest-free if repaid in the first year. These will be a source of working capital for businesses, helping with things like fixed costs like rent. The scheme went live last night and is able to receive applications from today. Payments will be made within 5 days of a loan being approved. So whether you're a sole trader wanting to borrow, for instance, up to $11,800 interest-free, or you employ 50 FTE staff and want to borrow up to $100,000 interest-free, go online to the Inland Revenue site and you'll find all the details there. And finally, our wage subsidy scheme has now paid out $10.7 billion to 1.75 million New Zealanders. That ultimately is what it has taken to make sure that we keep those people employed to their place of work, and so they can be at the ready when their businesses open back up. Finally, on public transport, with more people returning to work under level 2, I do just want to make a bit of comment on public transport and people getting to and from work. You remember when we talked about the Alert Level 2 framework, I really encouraged employees to have conversations with their employers around whether or not they'll continue working from home or whether they'll be coming into their place of work. And I really want to encourage those conversations to be had, to discuss whether or not there are options around flexible starting and flexible finishing times to perhaps space out necessary commutes. I imagine some workforces will be looking to look in the productivity gains that were made while people were working from home, and that's one way that they can do that. I know there's some good guidance that will be issued, but in summary, plan your trip, keep your distance, and that will be required on public transport, and of course track your journey as well. And as always, if you are sick, stay at home. I would encourage patience across the board, though, particularly in those first few days of level 2. As we have with every level, it will probably take a period of adjustment, particularly as people work out the best time to travel on routes that allow distancing. Finally, I've seen a bit of commentary overnight and this morning from businesses and people about how they're preparing for the next stage of life. And I'd sum up what I've seen basically with Kiwi businesses and Kiwis just getting on with it. Cardrona Ski Field, for an example, is getting ready for skiers to hit the slopes in late June, and working with the government on standards to set up zones around areas where groups may come together, like near chairlifts, planning for a domestic market, and ensuring that they've got really strong contact tracing in place. A Wellington hairdresser is doubly pleased she can reopen on Thursday and has made it this far without needing to make any of her team redundant because of the wage subsidy. Others have written to me about catching up with their wider families, conscious about those small gatherings and keeping it small, and I have to say that's something I'm looking forward to as well.